innovative 5-step patient interview approach for providing mental health care, AlKhathami Approach. Case scenario: Sammy and his suffering with uncontrolled diabetes mellitus. A patient named Sami is 60 years old and suffers from uncontrolled diabetes mellitus. Despite taking the highest doses of 2 medications, sulfonylurea and glucophage, his HbA1c levels reached 13%. Sammy has been committed to following his health and drug instructions. As per the approved treatment guide, his family doctor has decided to switch him to insulin. The patient refused to take insulin because of his old age. This decision was supported by the specialists at the hospital. However, the patient insisted on his decision, so the specialist decided to refer the patient back to the family doctor. Upon his return, the patient met with a family physician trained in the 5-step approach to patient interviewing. The doctor began following a 5-step process, better to understand Sami's perspective beyond his age-related concerns. A summary of the 5-step patient interview approach, AlKhathami Approach. This approach offers a structured way to integrate mental health care into primary care practices. Here's a breakdown of the 5 steps. Step 1, suspected. Identify patients who might benefit from the interview. This includes those with uncontrolled chronic diseases, diabetes, hypertension, etc., frequent healthcare visits, sleep problems. Step 2, screening. Assess for hidden agendas, delusions, and psychological stress. A. Hidden agenda and delusion. Use the ICE technique, idea, concern, expectation, to explore the patient's perspective and identify urgent cases needing immediate referral to a psychiatrist. B. Psychological stress. Ask specific questions to determine the stress level, mild or moderate severe, based on sleep patterns, concentration, social behavior, and anger management. Step 3. Scoping. Determine if the referral is necessary. Mild to moderate depression and anxiety can be managed by primary care doctors. Other mental health issues or suicidal thoughts require referral to specialists. Step 4. Diagnostic. Determine if the patient has depression or anxiety. Use specific questions to diagnose depression or anxiety. Step 5. Management. Develop a treatment plan based on severity. A mild stress? Focus on non-medication interventions like sleep hygiene, relaxation techniques, and exercise before considering antidepressants. B. Moderate severe stress. Consider antidepressant medication, with exceptions. Mood changes due to other medications. Modify medication and reassess. Difficulty coping with life events. Try narrative therapy first, then reassess. Doctor-patient interview session. Step 1. Suspected. The doctor thinks, does the patient need mental health care?
Good morning, Mr. Sammy. Thank you for coming in today. I understand that you've been struggling with uncontrolled diabetes mellitus. I've reviewed your case, and despite your adherence to the medication instructions, your HbA1c levels have reached 13%. That's quite high. Considering this, I believe it's necessary to switch you to insulin, as per the approved treatment guidelines. What are your thoughts on this?
Doc, I appreciate your interest, but I'm hesitant to start insulin. I'm getting older. I am a 60-year-old man, and I have reservations about it. I've already discussed this with the specialists at the hospital, and they have made the same decision. However, I still don't feel comfortable with it, so they referred me back to you.
Step 2. Screening. The doctor thinks, does he have hidden agenda or delusion and/or stress? ICE technique.
I understand your concerns, Mr. Sammy. We need to find a solution that you feel comfortable with. Before we proceed, I'd like to ask you a few questions to better understand your situation. Firstly, What do you think is the reason for not being able to control your diabetes?
Well, Doc, I've been doing my best to manage it. I take my medications regularly, watch my diet, and exercise. But it just seems like no matter what I do, my blood sugar levels remain high.
I appreciate your efforts, Mr. Sammy. It can be frustrating when you're doing everything right, but your diabetes isn't under control. What makes you afraid of not being able to control your diabetes?
I worry about the long-term consequences, Doc. I don't want my health to deteriorate further, and I don't want to burden my family with my medical issues. It's a constant source of anxiety for me.
I understand your concerns, and it's natural to feel that way. Now, what do you expect me to do for you regarding your uncontrolled diabetes?
Well, Doc, I hope you can find a solution that doesn't involve starting insulin. Maybe there's another medication or treatment option we can explore. I just want to get my diabetes under control and avoid any further complications.
Doctor's notes. All answers were within the logical thing and normal, no hidden agenda or delusion. Stress screening.
Thank you for sharing your thoughts, Mr. Sammy. I appreciate your honesty. Now, I'd like to ask you a few more questions to assess your overall well-being. These questions will help me understand if any underlying stress factors might be affecting your health.
Sure, Doc. Ask away.
Sleep indicator.
When you put your head on the pillow, do you sleep well, or do you have difficulty sleeping?
I have difficulty sleeping, Doc. It's hard for me to fall asleep.
Do you find that your sleep gets disturbed for no apparent reason?
Yes, sometimes my sleep gets disrupted without any clear cause.
Concentration and performance.
Have you noticed a decrease in your concentration and performance lately?
Yes, Doc, I have. It's harder for me to focus and perform tasks like I used to.
Relationship indicator.
Have you become more inclined to sit alone than before?
Yes, I have. Even though I used to be sociable and enjoyed being around others, lately I find myself wanting to be alone more often.
Have you noticed yourself becoming more easily provoked? Do you get upset quickly and find it difficult to handle discussions like before?
Yeah, Doc, I've noticed that. I tend to get upset more quickly and find it harder to handle disagreements or discussions without feeling overwhelmed.
Doctor's notes. Anyone who said yes means there is a positive for stress screening. The patient experiences difficulty sleeping, decreased concentration, increased desire for solitude, and heightened sensitivity to stress. In conclusion from Step 1 and Step 2, Sammy needs mental health care and has moderate severe stress. Step 3, Scoping. The doctor thinks, does the patient need to be referred to a psychiatric clinic or stay under the family doctor?
Thank you for answering those questions, Mr. Sammy. Based on your responses, it seems that you're experiencing moderate to severe stress. It's important to address these stress factors in addition to your diabetes management.
I never really thought about stress being a factor in my health issues, Doc. I always attributed it to my diabetes, but I guess it makes sense.
Yes, stress can have a significant impact on your overall well-being, including your ability to manage your diabetes effectively. In your case, I believe you should receive mental health care alongside your diabetes treatment. However, after assessing your symptoms, I don't think you need to be referred to a psychiatric clinic. You can continue under my care as your family doctor.
That's a relief, Doc. I trust your judgment, and I feel more comfortable continuing with you.
Doctor's notes. Sammy has no suicidal or psychotic dementia symptoms or drug abuse. The patient requires mental health care for moderate severe stress but can stay under the family doctor's care. Step 4. Diagnostic. The doctor thinks, does the patient have depression and/or anxiety?
Now, Mr. Sami, I'd like to discuss your emotional well-being. We need to understand if you may be experiencing depression or anxiety. Please answer the following questions honestly. Inside you, do you feel happy and relaxed, or do you feel uncomfortable or unhappy?
I don't feel as happy as I used to, Doc. I often feel a bit down and uneasy.
Have you noticed if the things that used to bring you happiness still have the same effect on you?
Not really, Doc. It feels like the things that used to bring me joy don't have the same impact anymore.
And how would you describe your overall state of mind? Do you feel relaxed, or do you feel tense and anxious most of the time?
Most of the time, I feel tense and on edge, Doc. It's hard for me to relax and feel at ease.
Lastly, do you often feel fearful about the future, specifically regarding your health or your family members?
Yes, Doc, I do. I worry about what might happen to my health and how it could affect my family.
Doctor's notes. The patient reports feeling unhappy, decreased enjoyment in previously pleasurable activities, feeling tense and anxious most of the time, and fear about the future. Conclusion. Sami has anxious depression. What is its classification? As the patient has moderate stress then, the final diagnosis was moderate severe anxious depression. Step 5. Management. Doctor thinks, what is the management strategy? As the case is moderate severe and no drug use affects mood and no precipitated social event.
Based on your responses, Mr. Sami, it appears that you have symptoms of both depression and anxiety. This is known as anxious depression, and it falls into the category of moderate severe. We must address these mental health concerns, along with your diabetes management.
I never realized I was dealing with a psychological disorder, Doc. I always thought it was just the stress of life and my diabetes causing my discomfort. It's a relief to have some clarity now.
It's understandable, Mr. Sami. Mental health concerns often go unnoticed, but they can have a significant impact on our overall well-being. Now, the recommended management strategy for your anxious depression is to start you on an antidepressant called escitalopram at a low dose of 5 milligrams once daily. Additionally, there are non-pharmacological strategies that can be helpful, such as sleep hygiene, regular exercise like walking, relaxation therapy, like deep breathing exercises, supporting your self-esteem, and avoiding arguments or stressful discussions.
That sounds like a comprehensive approach, Doc. I'm willing to give it a try. Anything to feel better and get my diabetes under control.
Great, Mr. Sami. We'll work together to help you feel better, both physically and mentally. Now, we will also schedule regular follow-up visits after 2 weeks with instructions to keep monitoring blood sugar levels.
Thank you, Doctor. I'll monitor my blood sugar and see you for the follow-up in 2 weeks.
Doctor's notes. Management strategy includes starting the patient on escitalopram 5 milligrams once daily. Non-pharmacological strategies such as sleep hygiene, exercise, relaxation therapy, self-esteem support, and stress management are also recommended. In follow-up visits, after 14 days.
Good morning, Mr. Sami. I'm glad we got together today.
It was a pleasure meeting you today, Doc.
I see here in your records that after 10 days from the beginning of the antidepressant, you experienced symptoms of hypoglycemia. To address this, we plan to decrease the dose of your sulfonylureas and closely monitor your blood sugar levels.
I truly appreciate your dedication to finding the right approach for me. It makes all the difference.
Doctor's notes. Plan to decrease the dose of sulfonylureas and monitor blood sugar levels closely to address hypoglycemic symptoms. After 2 months.
Hi, Doc. Thank you for seeing me today. I am encouraged to see you again. I would like to update you on my health since my last visit. I have to say, Doc, after starting the treatment for my depression, I've noticed a significant improvement. All my depression symptoms disappeared after 2 months, and I feel happier now. My blood sugar and HbA1c are also down to 7%.
I'm glad to hear that, Mr. Sammy. It's heartening to see the positive impact that addressing your mental health concerns has had on your overall well-being. Sometimes, the focus on physical symptoms can indeed overshadow the importance of mental health.
Patient's comments.
The last time I laughed heartily like now was when I was 15 years old. Unfortunately, throughout my suffering with diabetes, and before that, it never occurred to me that I was suffering from a psychological disorder. I used to think that life was like this, and that the obligations of this world were the reason for my psychological discomfort. The great mistake that doctors blame is that the length of my diabetes treatment did not occur to a doctor if he asked me about my sleep, my performance, and my psychological comfort. I started all doctors focus on diabetes and its symptoms and blamed that I did not adhere to their advice despite my full commitment. I'm grateful that we could identify and address it in your case. I'm grateful too, Doc. I'm finally able to enjoy life and spend quality time with my family without the burden of constant worry. Thank you for your support and expertise.
You're most welcome, Mr. Sammy. It's been a pleasure working with you. Please continue to follow the management plan for anxious depression, including non-pharmacological advice and taking escitalopram as prescribed.
In the present time, Sammy lives his life happily and spends most of his time with his family in comfort. He goes out shopping with them and visits his friends. He receives visitors. He does not suffer from sleep disturbances or psychological upset feelings. In addition, he does not use any diabetes treatment and is at normal levels. Sammy continued on the management plan for anxious depression, consisting of non-pharmacological advice and escitalopram 10 mg with regular visits to his doctor every 8 weeks after his condition stabilized, and he reached remission status.